Well, welcome to phase 7 of the PrescriptFit Medical Nutrition Therapy Plan. I'm Dr. Stanford Owen. Welcome back. Hopefully you're sitting there with your counselor at your doctor's office. And be sure and fill out your medical nutrition therapy follow-up sheet. Fill out your basic information at the top, the diet strategy that you're following. This week it'll be PrescriptFit phase 7. Any medications that you're taking, if you've deleted or left off or had a medication stop, just leave it off. The exercise that you are doing currently and which ones you're planning, from walking, jogging, the gym, yoga, swimming, biking, calisthenics, dance, tennis, any exercise is good. Your family trust. Are you struggling with your spouse, or are your kids giving you trouble? What about your parents, friends, work colleagues? Have you thought about how to strategize with them in terms of gaining control of the environment? Is the environment basically getting cleaner, or filling up with the pork, the beef, the dairy, the sugary drinks, the starches? Always remember, it's easier to not eat them if they're not there. Record your symptoms, 0 to 10, on the 8 cardinal symptoms. They should be markedly improved and relatively stable by this point in time. Notice if you splurge intentionally or accidentally, do your symptoms come right back, and how quickly and how much? It's very important, especially at this part of the diet strategy, to understand that food can make you ill. Even a single splurge day can have an impact. Now, if they're separated, usually it's not that big of an impact, but it can have an impact. Note that so that you can file it in your brain and use that as a learning tool to manage splurging in the future. Any new clinical measures that your provider has measured, and your plan of action for this week. The diet will be PrescriptFit phase 7. Exercise, how many minutes a day are you planning? Environmental cleanup, is there any more work to do this week? And family trust, is there any more work to do with your family, your friends, your work colleagues, your parents, your kids? And any change in medication down at the bottom of the sheet. Hand this back to your provider for recording. At this point in the diet, I also recommend you go back to the book and reread chapters, food phases 1 through 7. It takes all of about 10 minutes. Make sure your strategy is being anchored into your brain at this point. And then phase 7 is fruit. Now, fruit gives you a lot of sweeter taste, and gives you a lot of variety, a lot of color. And so we want fruit to be brought into the environment as much as possible this week. Kids really like fruit, so it's one of those things you really want to keep around all the time anyhow. Nuts and fruit in particular for kids are good snacks. There's no overdose. Remember, each phase is all you can eat, all you care to eat. So fruit, phase 6, nuts, phase 5, eggs, phase 4, non-starchy vegetables, phase 3, poultry, phase 2, seafood is now all incorporated into your diet. Remember, you don't have to add these in necessarily that order, but those are the 8 cardinal basic, what we call green foods, that are not going to harm your metabolism, that are not going to cause insulin resistance, that are not going to cause a problem with your medical issues. From this point forward, phase 8, a little bit with protein snack bars, but especially 9 through 13 in splurging, you can have an impact on your disease. So we want you to live your life at this point in phase 1 through 7 most of the time. If you've not experienced any specific fruits, if there are fruits that you haven't eaten before, try them out. You know, spend some time in the fruit section at your grocery store or your farmer's market, and see if you can expand your talent on your tongue a little bit. So next phase will be phase 8. We'll actually be adding snack bars in. That gives you a little bit of mobility and a lot more entertainment for sure. And we'll give you a lot of ideas for snack bars. So we'll see you in phase 8.